everyone, myself Shanaz and I welcome you all to my channel Nurses, the Heart of Healthcare. The theme of this video is identification of the patient correctly. That is, how to avoid patient identification error in a healthcare setting. Patient identification errors are an unintentional and avoidable harm to the patient by the medical system. So how to do it? Let us see. Before moving ahead, I would really appreciate if you all subscribe my channel Nurses, the Heart of Healthcare, and if you like the content, please like and share my videos. Patient safety is an important issue in a healthcare setting today. And to improve and ensure patient safety in some of the problematic areas in a healthcare setting, JCI, that is Joint Commission International, has introduced 6 International Patient Safety Goal, that is IPSG goals, what we call. In that, the first one, as you can see on the screen, is identifying the patient correctly. Second, improve effective communication. Third, improve the safety of high alert medication. Fourth, ensure correct site, correct procedure, correct patient surgery. Fifth, reduce the risk of healthcare associated infections. And number 6 is reduce the risk of patient harm resulting from falls. Among the 6, identification of the patient correctly has been given priority number 1. That means it is something very, very important. Okay, so let us see. To make a hospital or a healthcare setting a safe area, a more safer area for the patient, we have to identify the patient correctly. Okay, so to understand this goal, we need to understand few things about it. The first one is, what is identification of the patient correctly? What does it mean? Second, why it is important? Third, how to do it? Fourth, when to do it? Fifth, who and where to do it? And number 6 is what happens if we fail to do it. So let us move ahead with each one first. First one, identification of the patient correctly. What does it mean? Identification of the patient correctly means identifying an individual as a person for whom a particular care, treatment, procedure or the service is planned. Okay? Then why it is important? It is important because patient safety is every healthcare professional's responsibility. And safe patient care starts with identifying the patient correctly for correct care. That means this goal is the basic and most important aspect of patient safety in a healthcare organization. How to do it? To identify the patient correctly, in most of the hospitals or in a healthcare setting, they use 2 basic patient identifiers. That is, one is patient's full name and second is the IP number. Patient's full name. That is, we have to check the patient's full name on the patient's ID band. This, as you can see, this is patient's identification band or the hospital band or the bracelet that the patient, we keep it on the patient's wrist when the patient is hospitalized. Means from the time of admission to till discharge, the patient will be having this band. In emergency, they keep a different kind of band, and once the patient is shifted to ward or ICU or the OT, wherever they are, then the band will be changed. Okay, so usually the stable patients, they will be given blue color band, whereas the vulnerable patients, they will be given yellow color band, and those patients who have any known drug allergy, they will be given a red color band. And for the pediatric patients, like for especially for the infants and the neonates, baby girl is given pink band and baby boy is given blue band. So there are different color of patient identification bands used in a hospital based on their hospital protocols. Okay, so the 2 basic patient identifiers are the patient full name and IP number. Okay, so using these 2, we have to identify the patient correctly. And patient's full name, we are supposed to ask the patient to verbalize their name. Okay, so when we go to the patient, we'll not tell them, are you Mrs. Lakshmi? No, we'll ask them to verbalize their name, because they can be difference in the pronunciation. Okay, like for example, you take example of these two names, Shravani and Shrabani. Okay, see, just one letter difference, and they can be two different patients, so this can cause a confusion. So that's the reason we have to ask the patient, if they are conscious, we have to ask the patient to verbalize their name. Okay, and then compare that with the patient's name on their ID band and in the file. Okay, and also the ip number, it will be there on the band and in the file, so we have to cross check that. And patient's name, I repeat, it should be full name. Okay, because it is quite common that there can be two patients with the same name. For example, you can take, there can be two patients with the name John and John. There can be two patients with the name Lakshmi and Lakshmi. Okay, so that's the reason you have to identify the patients with their full name. They can be Lakshmi Reddy, Lakshmi God, or John Francis, John Fernandez. Okay, so you have to use patient's full name to identify them, and the IP number. Okay, so in case of conscious patient, we can ask the patient itself to verbalize the name, and then we can cross check it with the patient's ID band, and we can check it in the file. But in case of unconscious patient, sedated patient, ventilator patients, psychiatric patients, very elderly patients, and in case of pediatric patients, how can we tell the patient to verbalize their name? No, then what we'll do? How will not identify the patient? We have to identify the patient. So how we'll do that? In case if the patient is sedated, unconscious, or shifted to other location in the hospital, or confused, or elderly patient, or psychiatric patient, or children, we need to cross check. I mean, if the patient's relative or attender is available, we can ask the patient's name through the patient's relative, but it's not possible that always they are standing by. Then what we can do is we can compare and verify the name of the patient to the ID band or the bracelet that they are wearing, and the same thing that we can compare it with the patient's file. Okay, so whatever is the condition of the patient, we have to identify the patient correctly using these two patients identifiers. It's very important to avoid identification errors. Then next thing is, when all we need to identify the patient correctly. We need to identify the patient correctly when we are administering medications to the patient by any route, oral, IM, IV, rectal, any route. By any route, if you are administering any medication to the patient, we need to identify the patient correctly. Next, before collecting and labeling the containers of blood, urine, or any other specimens that we are collecting from the patient. And next one is, when we are providing any kind of treatment to the patient, or before doing any procedure on the patient, before serving the therapeutic diet to the patient, on before administering blood and blood products to the patient, before diagnostic procedures, and before the surgery. Okay, so these are the different situations wherein we have to identify the patient correctly before doing it on the patient. Okay, then next one is who and where. Who and where. Who? Every healthcare professional who comes in contact with the patient till they are in a hospital setting need to identify the patient correctly when they are coming in contact with the patient. Okay, that means doctors, nurses, pharmacists, okay, the admission department people, okay, so everyone, whoever is providing F&B, okay, whoever is providing any kind of service to the patient, they need to identify the patient correctly before giving care. Okay, then where all it need to be done, irrespective of wherever the patient is in the hospital, maybe in emergency department, in ICU, OT, or in any diagnostic procedure room, or in the wards, wherever the patient is, irrespective of the location, patient need to be identified correctly in all situations and in all locations. Then last one, what happens, this is very important, what happens if we don't identify the patient correctly? It will cause patient identification errors. If we fail to identify the patient correctly, then it leads to patient identification errors, which can cause medication errors, transfusion errors, testing errors, procedure errors, and to an extent that a wrong baby can be delivered to wrong family. Okay, so that's the reason patient identification is a very important step. See, it is an unintentional harm by the medical system. Nobody wakes up in the morning and comes to the hospital with an intention to harm their patients. No one, no healthcare professional. Everybody is coming with a pious intention to serve better, yes, and to make their patients more comfortable and they, ease this tough period. Then just one step if we miss, it can cause a big harm to our patient. So that's the reason, please identify the patient correctly using these two basic identifiers before providing any care or treatment to the patient, so that we can avoid this unintentional patient harm by the medical system. So follow IPSG goal 1, that is identify the patient correctly, so that we can make our healthcare settings a more safer place for our patients. Thank you so much. I hope this video and the content has helped you in understanding what is the importance of identifying the patient correctly in a healthcare setting. And if you like the content of this video, please like, share and subscribe my channel Nurses the Heart of Healthcare. Thank you so much. Stay connected.